Hello, and welcome to our cortisol-infused tympanostomy ear tube presentation and why you should invest in it. Here's a diagram of our product. It is located in the middle of the ear and the eardrum, and it has an infused cortisol coating. What is a tympanostomy ear tube? It is classified as a Class II device, and it is applied directly to the inside of the eardrum, ensuring effective fluid drainage and reduced inflammation. Metal rings add stability on the outside, while the tube itself is plastic and ductile for insertion and comfort.
The ventilation tubes inserted via surgery serve dual purposes. They facilitate airflow and fluid drainage between the auditory canal and middle ear. This helps reduce ear infection and equalize air pressure, ensuring optimal ear health with a single intervention. Let's dive into the fascinating anatomy of the ear. The insertion tube is a narrow passage that connects the middle ear to the back of the throat. In children, the insertion tube is shorter and more horizontal than in adults, making it more prone to infection. About approved indications, we have cases of otitis media, that's infection in middle ear. Another indication is the presence of the persist high negative middle ear pressure. Lastly, we have athletics. This is a condition where there's a collapse or closure of the ear.
Current competitors and limitations. This table summarizes FDA-registered tubes like Medtronic, Chula, Grace Medical, Smith & Nephew, and Hummingbird. While they have similarities, none include a cortisol coating. Notably, Grace Medical uses a polycarbonate coating which improves chemical resistance and dimensional stability, but does not reduce infection risk.
Here's a description of our drug. Cortisol is a steroid hormone falling in the glucocorticoid class. It is released by the adrenal glands located atop the kidneys and regulates the body's stress response, metabolism, and responses of the immune system. When used as a drug, it is known as hydrocortisone, and it calms the body's immune response. This synthetic form of cortisol is used for anti-inflammatory and immunosuppressive properties, and is commonly found in creams, ointments, and pills. As a cream, it can relieve itching and swelling. In oral tablet form, it can help with severe asthma, and in eye drop and ear drop form, it treats inflammation. Corticosteroids are a type of anti-inflammatory drug made to closely resemble the body's naturally occurring cortisol. Compared with acetic acid ear drops, corticosteroids are more effective in treating acute otitis externa, also known as swimmer's ear. In this graph, the green line represents corticosteroids, and it shows that symptoms for these last 6 days as compared to 7 or 8 days with acetic acid drugs. Some more clinical data shows a p-value of 0.001 for 14-day and 21-day trials using cortisol and antibiotics. This small p-value highlights that cortisol and antibiotic will be most effective. And while swimmer's ear is an external ear canal infection, the success of these corticosteroids in these ways showcases it could be potentially used in inner ear infections. There's already a market for corticosteroid therapy in the middle ear for inner ear disorders, so investing in the cortisol-infused tympanostomy ear tube would be investing in 2 markets at once. This tube then not only aids with fluid drainage and infection prevention aforementioned, but could potentially be used as a temporary implant to continually provide cortisol relief for those with hearing loss, vertigo, which are balance issues and dizziness, or tinnitus, a perceived ringing in the ears. The corticosteroid market grew $0.21 billion from last year and is projected to reach nearing $6 billion in 2026. Investing in this market with a growing demand predicts a high payoff.
I will talk about the history of cortisol. Discovered in the late 30s as compound E, cortisol has its medical breakthrough in 1948 when it was effectively treated disease. It has since evolved into various forms like tablets and creams, treating conditions from asthma to skin issues. Today, it's recognized both as a water stress hormone and medication, continually studied for its dual roles.
Our device is a Class II device, a standard tympanostomy ear tube. Its diameter is 1.1 millimeters for infants and young children, up to 1.6 millimeters for adults. Typically, the measurements are 1 and 1.5 millimeters, but ours is adjusted for the cortisol coating we are adding. The length is 3.5 millimeters for optimal ventilation, allowing fluid to drain into the ear canal. The coating of the tube follows a controlled release cortisol method for a period of 18 months. This lengthy duration permits cortisol to be diffused into the middle ear to aid in fluid drainage by preventing recurrent ear infections. By using cortisol, a hormone that produces many anti-inflammatory effects, swelling will be reduced within the ear, which could allow for the tube to potentially fall out quicker than this 18-month period by promoting quicker healing.
What is the FDA Breakthrough Program? This program accelerates the development and review of medical devices and combination products for severe conditions, expediting processes like pre-market approval, 510(k) clearance, and de novo market authorization. Breakthrough status ensures rigorous safety standards, promoting innovation and public health. Advantages of the program. Manufacturers gain efficient, direct access to FDA experts for pre-market reviews, ensuring timely feedback and consensus. Expediting market authorization. The program promotes regular collaborative communication between manufacturers and the FDA, addressing questions and concerns promptly to reduce potential delays in development and approval. Criteria to join. Firstly, it must significantly enhance treatment or diagnosis effectiveness for life-threatening or irreversibly debilitating conditions. Secondly, the device must align with at least one of the following conditions: representing breakthrough technology, having no approved alternatives, offering substantial advantages over existing options, or being in the best interest of patients' availability. Why is our device eligible? We meet the first criterion by improving treatment for life-threatening ear complications. Our device aligns with the second criterion as it represents a groundbreaking advancement in ear infection treatment, reducing reliance on antibiotics and surgeries. This innovation elevates patient outcomes and accelerates healing, making it a standout candidate for inclusion. We hope our device makes a difference and are confident for it to surpass the Breakthrough Devices program. Thank you.